Hello everyone, my name is Jennifer Allen. I'm with TransMed Health and Wellness Center, and today I am with Dr. Emily Mayfield with Mindset Therapy. Hi Dr. Mayfield.
Hi, how are you today?
I am blessed. Look at this beautiful weather.
It is nice.
It's
Texas
incredible.
November.
Texas November, we'll take it. And thank you so much for allowing me to ask you a few questions about mindset therapy. And I'm really excited because I love anything that involves the mind. So without further ado, tell me a little bit about mindset therapy.
So first of all, I'm a psychologist, and so as a psychologist, I am trained in different therapies and techniques to help people work through some of the stressors that they might be experiencing, help them identify what those stressors are, and tools that they can use to make changes in their life. Sometimes we can't change our situations, but we can change how we interact with the situation and the environment. And so when you come to a psychologist, they can help you learn those techniques as well.
Okay, and do you have a specialty?
Yeah, so I work with adults, so anyone over the age of 18, and I primarily work with individuals versus couples. And then as far as the different conditions or disorders that I treat, I see a lot of depression, anxiety, relationship stress, occupational stress, sleep problems. So those are, I think, present to some degree in most everyone. And it can reach a point where it starts to interfere with your life, and that's often when people come into therapy. However, ideally, if you come in sooner versus later, then you can, again, learn those tools and techniques before it becomes something that impacts your ability to be in the relationship, to work at your job, or just to do your everyday things that you enjoy. And so within those specific symptoms or disorders and conditions, I use various treatment techniques. So some of the ones that I use are relaxation, mindfulness, cognitive behavioral therapy. And with all the different techniques that are used, the goal is to give you the tools so that you can come in, learn the tools, and apply them in the absence of coming to therapy for a prolonged period of time.
Okay, awesome. And I follow you on social media on Instagram and Facebook, and I love the content that you put out. It is absolutely amazing, and it resonates with me so much. So you're also on Instagram, Facebook,
YouTube, and Twitter. Yes, and so my YouTube channel I created, I upload videos 2 times a week.
Okay.
So on Tuesdays and Fridays, and my intent behind creating the YouTube channel is oftentimes people just aren't ready to come to therapy. They have symptoms, they have concerns, they have people in their life that they're concerned about, but they're just not ready to come to therapy, either mentally not ready, financially not ready, don't have access to therapy. And so with the YouTube channel, although it's not meant to serve in the place of treatment, it does give information on common mental health topics, so that people can be more informed and also recognize if what they're experiencing is normal or not.
Sure.
And so the YouTube channel has the videos, and then the Facebook, Instagram, and Twitter work together with everything to give just additional pieces of information to help people with their mental health.
And that it does. I love it. Okay, so question for you regarding your clients. Do you see them in person or telehealth? Or
So mindset therapy is different. It is a proprietary platform that's HIPAA compliant. It's 100% part of mindset therapy. And it is all telehealth, but it also allows the individual to have unlimited messaging with their provider.
Wow.
So it is subscription based.
Okay.
So there's 2 levels of subscription. The first level, you pay a monthly fee and it's just unlimited messaging. And then the second level, also a monthly fee, unlimited messaging, but you also can get weekly video sessions with your therapist.
Awesome.
And so what I have found is that having that access to your provider, so between the patient and the provider throughout the week, is really beneficial to help people stay on track with their treatment, or if something comes up and your appointment isn't for another week or 2, Oftentimes it's hard to remember to bring it up at the next session, or maybe it's not a big deal 2 weeks later, but it was at this moment. So it really helps keep the treatment real time versus whatever happens when you go into your session.
Wow, that is fascinating.
Yes.
Okay, and so how can people find you on the different social media platforms? What is your handle, or how can they find you?
Yes. So the website is mindsettherapyonline.com.
Okay.
And on that website, it does have links to all of the social media. However, on social media, it is called Mindset Therapy PLLC.
Okay, perfect. Okay,
Yeah.
and then if they want to schedule an appointment to see you, how would they do that?
Go to the website, so
Okay.
mindsettherapyonline.com, and you can sign up for one of the subscription levels, and then
Okay.
as soon as you sign up, I get notification, and then I start contact with you either through the messaging and or helping you schedule that first appointment.
Wow, awesome. Very good. You guys, this is so great. And so I'm so glad you're part of the TransMed Health and Wellness Complex. Go to our website, subscribe to a subscription so you can have access to Dr. Emily Mayfield. And is there anything else you would like people to know about what you do and the work that you do?
Yeah, so one thing also about the symptoms that are treated is people often experience chronic pain and other physical symptoms that are impacted by their mental health. So if, take chronic pain for example, if your mental health is worse, it affects your chronic pain. And if your chronic pain is worse, it affects your mental health. So if somebody's seeing their medical provider, physical therapist, massage therapist, and has issues with pain, it's always good to also come in to see a psychologist to help improve your mental health, which will help the pain experience.
Awesome. I love that. Okay, guys. Well, thank you so much for your time today. Again, I'm so glad that we got to sit down and talk, and you guys give Dr. Mayfield a call today.
Yes, well, thank you.
Thank you very much. We'll talk soon.